Greetings and warm welcome to everyone joining us from the various corners of the digital realm. Today we are going to discuss about the topic biochemistry in medicine, the molecular basis of health and disease. I'm glad to introduce the speaker of the day, Dr. Naveen Kumar, assistant professor in Zambia. So over to you, sir.
So, good afternoon, one and all. So, welcome to today's webinar on biochemistry in medicine, molecular basis of health and disease. So, in this session, we are going to discuss about the role and the importance of biochemistry in medicine, and the recent breakthroughs and how biochemistry, the knowledge of biochemistry, helps the doctors and the researchers and the students to understand the intricate and the complex metabolic pathways, and that yes, that are the secrecy of the life, and that underlies in diseases and in normal as well as diseased conditions. So this presentation is quite big presentation which covers all aspects of biochemistry, including fundamentals to the most recent advances. So generally, biochemistry is often considered as the chemistry of life or language of life. It allows us to decode the complexity of the life, such as to understand the biological system at cellular and molecular level, and how the cells functions and how the cells communicate and how they respond to different, that is stimuli like hormones or the ligands, and certain protein molecules or the signaling molecules. And the knowledge of biochemistry helps understand the enzyme activities, and that is at gene expression levels and in normal as well as diseased conditions, right? So this, let's delve into this, that is the molecular biochemistry, and that is and the genetics role in modern medicine. So biochemistry, if you see the definition, that it's a broad definition. For example, if you see in a brevity manner, biochemistry bridges connects the biology and the medicine, and revealing life's molecular intricacies. It means, it helps us to understand that life at the molecular level, at the cellular level, how the, that proteins, DNAs, and as well as the enzyme, how they work in under various circumstances or the conditions. And it decodes the language of health and disease, that is, that is empowering medical professionals with precise insight. And it helps us to gain the knowledge about, that is certain uh, disorders and diseases. For example, as a doctor or a researcher, you must have the foundation or the fundamentals of biochemistry to understand the sequence and the structure of certain biological macromolecules such as proteins, lipids, as well as nucleic acids, and their role and involvement in various diseases and disorders. Some diseases we know that they are inherited. So for that, we must understand at molecular level, genetically transmitted, like from parents to that is offspring or the children. So then, there's in this picture, that yes, you can find, that it is an interdisciplinary field which connects various fields, subset of fields, and like medicine, biology, chemistry, and all those things. And the key focus will be, that yes, it focus biological macromolecules such as proteins, carbohydrate, lipids, and nucleic acids, and their role in diseases such as, that yes, how the proteins or the, that lipid concentration will influences the diseased states and all those things. For example, let us say simple diabetes mellitus. So that it is a hyperglycemic condition, but we must understand at the molecular level what happens to these glucose transport system, why the glucose is not being properly utilized by the cells, like that. And the very important thing, the application, the knowledge of biochemistry will helps us to understand the disease first, and it helps us to diagnose the disease, followed by the prognosis. So thereby you can, that suggest a better treatment, such as cancer, as well as let it be diabetes or the hypertension or any disorders of the diseases. And apart from that, that beyond diagnosis and treatment, a lot of advancements happened because of the advent of technology like DNA technology and proteomics and genomics. Now the biochemist is getting assistance from those, the new disciplines. So to develop, that a potent or the, that is drugs with low cytotoxic effects, those things. What is the role of biochemistry? Exact role of biochemistry, that is to understand the disease process, right? As well as that is to understand the body functions, including from the simple digestion and absorption to the complex signal transduction mechanisms, and that developing treatment by collaborating, that is with other pharmacology scientists, or that is drug discovery process. It helps. And that yes, and still that yes, lot of that yes, pathways has to be unraveled. So, a lot of that secrecies are had to be decoded. So to understand the disease at the molecular level, such as that cancer, if you see the cancer, that yes, a cancer cell may follow that adapt different types of mechanism for its invasion, right? So the biochemistry helps us to understand the that yes, the cellular intricacy at the that yes, molecular level. And in disease and diagnosis, for example, let's say some examples, the blood test like that, it is called, it comes under clinical biochemistry. And that medical biochemistry like that, glucose levels in, it is imperative that the glucose level has to be monitored in diabetes patients in order to maintain the homeostasis of blood glucose levels. And the lipid profile also very very important for the CVD, cardiovascular risk assessment. And the liver enzymes like SGOT, SGPT, like aspartate transferase and alanine transferase also very important. It tells us about the health status of the liver condition in normal as well as in chronic alcoholic people also, and in chronic liver diseases also in alcoholic patients or the in alcoholic people like that. And genetic screening nowadays, that yes, genetic screening also very very important to predict like the mutations. Like for example, let's say cancer, breast cancer, BRCA mutations in breast cancer. You can assess the risk of the breast cancer at a particular stage. We can anticipate when would that particular gene, mutated gene, will express in certain people like that. And the karyotyping also detects the chromosomal abnormalities, particularly that is in like from fetus or like that, in order to prevent some genetic disorders. And the biomarkers, for example, the elevated troponin levels indicate that yes, the dysfunction of the heart, some of the smooth cardiac muscle will might be that damaged like that. You can anticipate, thereby you can approach, go for the treatment immediately without further delay. And that prostate specific antigen, that which predicts the prostate cancer. And C-reactive proteins, these are few examples only. Thousands of markers are there. So, like that's a like inflammatory agent, right? It tells us about if the CRP levels are more, it should be less than 6 milligram per 100 mil or DL. If it elevates beyond 10, like that, that if it elevates 3 to 4 times to the normal, it indicates some infection is spreading in our body like that. So this biochemistry knowledge helps us to evaluate and assess the diseased conditions. If you see the historical milestones in biochemistry, early foundation, they mostly focused on the enzymatic discoveries like fermentation by the Pasteur and the Buchner like that. Next one is next at the early of the 20th century, they mostly focused on the vitamin discoveries like B complex and the C and all those things, and those deficiency disorders and the diseases. And that the a major breakthrough happened at the middle of the 20th century, mid of the 20th century, after the elucidation of the DNA double helical structure by Watson and Crick, and the successful explanation of the central dogma of life by Crick. Then it changed the entire, that yes, the biochemistry scenario, probably the medicine also, right? And very importantly, post the 2000, it is called genomic era. So after the completion of the human genome project, the entire human that is DNA sequence is available in databases such as NCBI. So anyone across the globe, they can access those genomic data and the proteomic data, like all these 23 chromosomes. DNA was sequenced and kept in databases, and we can access, the scientists or the doctors or the researchers can access those genomic sequences, and they can compare with the, that mutated ones, and they can understand the disease in a better way, right? So which improves the, that yes, targeted therapies in future. And let us start from the, that actual discussion, like the biochemistry. Basically, the start with, but there are different phases of it. First one is, we must understand the biological macromolecules, like their structure and their classification, how they are made up of, and then it helps us to understand their function also, like carbohydrates and the lipids and the proteins and nucleic acid, how they, that yes, behave in cells, and what is their role, what exactly they do, and how much of energy will be derived from these macromolecules. Let's say, that carbohydrate, lipids, and the proteins, they produce energy. Like carbohydrate produce 4 calories per gram, and the lipids 9 calories. The question is, why lipids produce more energy? This is problem, right? So if your diet is enriched with more lipids, it definitely it will create problem, because they are high energy compounds of the molecules, right? During oxidation, they produce more energy. Second thing is nucleic acid. They are the repository of the genetic information. They store the genetic information responsible for the hereditary, but they never produce any energy. So, for of course, the proteins, the flow of genetic information starts with DNA, and it produces an, that is like mRNA, messenger RNA, and finally it ends with, the information will be decoded successfully into proteins. So what I'm saying, that the language of four, that is ATGC, nitrogen bases, is finally converted to the language of 20, like, that amino acids, 20 different types of amino acids, right? In the form of codons at mRNA and individual amino acids at the protein level. And next one is, once you understand the, that yes, the macromolecules like carbohydrates, proteins, lipids, and nucleic acid, then the most important thing is enzymes. So these are the catalysts of life. All the molecular pathways, the metabolism or the signal transduction pathways or the cell-cell communication, they are mediated by an intermediate called, that yes, enzymes. So, for example, there are different types of enzymes are there, like based on classification, six major classes, but their role is major role is in metabolic pathways, and another role is, that they serves as clinical markers. For example, ALT, alanine transferase, and aspartate transferase, and that is alkaline phosphatase. So the analysis, the study of these enzymes will tells us about the health status of the liver function, like hepatitis and the cirrhosis, liver cirrhosis, like that. As I mentioned earlier, troponins and the, creatine kinase, it tells us about. So, for example, what will happen? These levels under normal conditions, these enzymes levels are very low or normal, within the normal range. If any damage happen to those tissues like liver tissue, hepatic, or the cardiac tissues, their levels will be elevated in, that is in the serum. So it tells us about the health. Some damage happen to that particular tissues, like that. So next one is, that such as hepatitis, myocardial infarction, like that. And for example, let's take cancer markers like lactate dehydrogenase and the PSA, and several enzymes are there, TNF, beta, and all those things. So lactate dehydrogenase and prostate specific antigen. So if their levels increases, elevates in, blood or serum, it's an indication of, that there might be some deviation happen to those cells. Like generally LDH levels are low in normal. When in cancer conditions, that yes, the LDH levels will be elevated. In laboratory, what we will do in cell culture analysis or in vivo analysis, the LDH assay is very, very important, right? To monitor the, that yes, the cancer uh, progression or anything. So next one is coming to this. Once you come study about the enzymes and all those things, then another major, discipline, or what you can say, let's say it is a domain. the major domain is the metabolism. So this is very important, that concept. It helps us to understand the carbohydrate, the macromolecules metabolism, and how the energy is being produced, as well as uh, how the, that yes, if any deviation happens in these metabolic pathways, what happens to the that yes, cells as well as to the tissues which affect the whole body like that. Then that let us start with a biochemical perspective of that carbohydrate metabolism, which directly associates with the diabetes mellitus. There are different basic pathways out there, that glycolysis and the glycogen synthesis, and others are the gluconeogenesis and all those things. First, we must understand how the glucose will enter into cell by a specific transporter systems like GLUT, glut transporters, so which are very, very important, that yes, in normal as well as, the diabetic patients. For example, in some diabetic patient, the glut number will be less in specific tissues. In some patients, that yes, in some people, that due to obesity and other reasons, insulin resistance will be developed. And finally, that which impairs or affects the carbohydrate metabolism, which eventually leads to the prevalence of the diabetes. So then, most important thing is that types of diabetes. You must know the types of diabetes, and you must understand how many types of diabetes are there, and what happens in those conditions like that. There are types of diabetes, that you can categorize into majorly two. Of course, gestational diabetes. It is a short period of time during occurs during the pregnancy time. Generally, it will be resolved after childbirth. But in some patients, that in some people like women, it may continue turned out to be in T2D, like type 2 diabetes, insulin independent diabetes mellitus, like that. So type 1 diabetes, that it is an autoimmune disorder where they know that yes, say insulin producing cells, that the beta cells are that damaged by the autoimmunity, or might be that yes, the pancreatectomy, right, the removal of the pancreatic gland, that typically can be seen in juvenile onset or adult onset, right, in children or the that is childhood or adolescence. And type 1 diabetes requires lifelong insulin therapy. You know that we need to take the insulin, like, that is recombinant insulin, and that is you need to take through intramuscular throughout the life before the food. And that we need to calculate the how much units of insulin required, thereby that based on your diet, food habits, so to maintain the glucose levels. So this is very important, this knowledge, right? And type 2 diabetes mellitus is very, very important, right? And most of the people, that yes, is suffering with around 80 to 90% of the population. For example, let us take 100 diabetes patients, right? And majorly they comes under, they falls in the second category, type 2 diabetes, right? So what is the reason for the type 2 diabetes? The body becomes resistant to insulin, or doesn't produce enough quantities of insulin or the units of insulin, which oftenly associated with the lifestyle factors like sedentary life, and that is excess eating, as well as lack of that is exercise, and the calorie management, poor calorie management leads to type 2 diabetes mellitus. Let's focus on the mechanisms of type 1 diabetes. First one is, as I told you, certain immune cells are that primed against to our own beta cells, which causes the breakdown or the degradation of eradication of the beta cells. So that eventually leads to the absence of insulin in cells. If insulin is absent, if you see the insulin basic function is, that yes, first one is it promotes the glucose uptake by the cell. Second one is, that glucose utilization. So in the absence of insulin, the glucose metabolism will be totally affected, which leads to hyperglycemia. So this excess of glucose, what will happen? And that leads to diabetes, ketoacidosis. The carbohydrate metabolism will be shifted and will be affected, and the lipid metabolism, particularly the ketone bodies levels, will be increased. It is in uncontrolled diabetes mellitus. Certain genetic factors also contributes to the diabetes, type 1 diabetes mellitus prevalence. like that HLA, human leukocyte antigen genes, that yes, increase susceptibility to the type 1 and I said, which these genes helps us to that yes, our system, cellular system, to distinguish or the discriminate self from the non-self. So it also leads to autoimmune disorder, certain genetic factors. Finally, the beta cells, or that is damaged. So our own immune cells will attack the, what do you call, our own cells. It is called autoimmune disorders. And next one is the metabolic consequences. That is, that this is also very important, like hyperglycemia and the ketone, as I discussed earlier. The hyperglycemia and that ketone body production is very that fatal, and which leads to acid base imbalance, and which affects the bicarbonate levels in our that body, that is the blood, and that it is very fatal condition, life threatening condition. So treatment must be started immediately. Otherwise, one has to monitor their that is what I'm saying, HbA1c levels, glycated hemoglobin levels, uh, in order to that yes, monitor, control the diabetes mellitus properly. And the mechanism of type 2 diabetes, that yes, it is mostly insulin resistance. Cells will develop, that yes, insulin resistance, and because of lack of excessive fat or the mutations in the receptors or like that. And the beta cell dysfunction also, for example, in certain patients or the people at certain period of age, the beta cells will become inactive, right? So then what happens is, we need to find the actual, that is cause or the reason for the type 2 diabetes mellitus. And the chronic inflammation also, that certain, that pro-inflammatory cytokines, that is low molecular weight proteins produced from the immune competent cells, like that yes, they causes such as, and of course adipose tissue also releases these cytokines, which causes the that yes, which interferes at insulin signaling through, what do you call, RTK pathway, receptor tyrosine kinase, like that, and improves the that yes, worsens the insulin resistance situation, right? And next one is, sorry, the reason, that factors of the insulin resistance, that is that the consequences, disrupted insulin signaling, as we discussed it, right? And the effects, pi3, that is, and AKT pathway, which affect the certain protein synthesis also, and the glucose uptake, that the GLUT4 levels will be decreased, right? So thereby, which directly affects the glucose entry into cells, and the free fatty acid levels also increased, right? And that excess breakdown of the fatty acid and the mitochondrial dysfunction. The mitochondria, we know that these are the very fundamental cell organelle that deals with the energy production, all these TCS cycle, as well as electron transport chain and oxidative phosphorylation will be impaired, which causes the depletion or the reduced levels of ATP and endoplasmic reticulum stress. These are at that a lot of research is going on at that is at molecular level, the role of mitochondria and as well as endoplasmic reticulum in certain inflammation conditions like that. And the complications of the diabetes, that is that particularly the vascular system will be affected, and that yes, like cardiovascular diseases such as atherosclerosis and dyslipidemia, and the lipoproteins levels will be imbalanced, and the LDL levels will be increased like that, and heart attack and the stroke. And the combination of diabetes and hypertension is very worse and the deadly combination, which causes a lot of damages to heart as well as brain and other systems, such as if you see the diabetic nephropathy. Diabetes, that it is a chronic metabolic disorder which affects almost all major systems, such as central nervous system as well as the vision. Diabetic retinopathy, it leads to vision loss and cataract and the glaucoma. And the diabetic neuropathy, that it leads to nerve damage, so, and the nephropathy, kidney damage. Most of the diabetic patients, they're prone to develop kidney disorders, CKD, chronic kidney disorder, because of this, lack of knowledge and the awareness. and the improper treatment and all those things. And the therapeutic strategies are, that unfortunately most of the, the diabetic drugs having side effects. First they will start with some medications like metformins, and later, that after some time they will switch over to the DPP for like the dipeptidyl, that yes, peptide 4 like that inhibits. But, after some certain time, that this slowly stops working. Like, what people directly know that here the diabetic patients here effective diabetic but is management is required. What most of the people will do, they blindly depends on medicine only. That is totally wrong. That apart from medicine, that yes, minimum 150 minutes of, that exercise per week is required, or at least 20 to 30 minutes brisk walking is required in order to maintain the glucose levels as well as the fat levels. And the diet, exercise, and the weight management are, along with the medication, the lifestyle modifications are very, very important, right? And for example, type 1 diabetes, as well as, that if it is an uncontrolled diabetes, where if the sugar levels are very high, then there is no option. It's better to switch over to insulin therapy for survival, right? And the emerging therapies. So still, that a lot of research is going on diabetes to improve the better medication. Currently, a lot of research is going on, that beta cell regeneration through stem cells, and to prevent the autoimmune disorders in type 1 diabetes, and gene therapy like that. Stem cell therapy is the promising, that is area where it can provide, that a better solution to the diabetes, right? And next one is, that proteins also a very important molecule. Apart from energy, they plays vital role in as a structural elements. These are the building blocks of cells and the tissues, right? A protein is made up of amino acid. A protein can act as an enzyme or the hormone or the receptor, or the contractile protein or the structural protein, or any or any whatnot, like ion channels and all those things. What I'm saying that protein metabolism, if you see this, it's very, very important, right? The breakdown of proteins will produce, that yes, ammonia. This ammonia must be converted to urea and must be excreted. Suppose if it is, that deviated, any fluctuation happens, then what happens? Yes, it leads to hyperammonemia, and that which crosses the blood-brain barrier and causes the necrosis of brain like that. And if you see the medical relevance of, the protein metabolism, nutritional deficiency, particularly, that is in developing countries and some poor countries, and what happened? Lack of, that is proteins. In proteins, the amino acids can be categorized at two major classes, like essential as well as non-essential amino acids. So those nine essential amino acids are plays vital role in cell growth and development, particularly during embryonic development and the fetal development. If the that during the gestation period, if the mother faces the deprival of this, that amino acids, nutrients, then which affects, that is directly affects the fetus growth and all those things. So that's why, like kwashiorkor and marasmus and all those things that comes under nutritional deficiencies. And certain metabolic disorders are there. These are at molecular level, like phenylketonuria, alkaptonuria, like that, Hartnupp's disease. And to understand those disease, we must start with, that yes, one must start with the amino acid, and how that amino acid is being synthesized, produced in our body, and how the breakdown, that yes, is mediated. And what happens if a specific enzyme associated with either catabolism or anabolism is absent? So like that. So then certain metabolic diseases even causes a neurological damage also. So what I'm saying that one should investigate, that the disease from 360 degrees, like, it might be from the carbohydrate or the protein, or, a lipid or the nucleic acid, sometimes combination of more than two macromolecules like that. The protein related diseases like cystic fibrosis, and that, so Just protein metabolism knowledge is very very important, not only for the nutritional deficiencies to understand the metabolic and genetic disorders also. And the next concept area domain is the nucleic acid metabolism, which is very very important. And the nucleic acid is metabolism is very important, crucial for DNA and RNA synthesis, as well as the DNA repair mechanism, which directly associated with different types of mutations as well. And one such example is the cancer, and like that. And the nucleic acid metabolism, we will get an insight, about how the DNA and RNA being synthesized, and how the DNA repaired if any mutation happens, and how the genetic integrity will be maintained by various types of cellular machinery systems like that. And the DNA, that is repairs disorders like Lynch syndrome, as well as certain types of cancers, xeroderma pigmentosum, and genetic diseases. A single nucleotide polymorphism can change the protein structure, right? For example, let us take sickle cell anemia. A single, that yes, a nitrogen base was changed at, the beta chain at the sixth position. Then what happened? The glutamic acid is substituted by the valine. So glutamic acid is an acidic amino acid. If it is substituted with valine, which is in a neutral or the hydrophobic, it totally transforms the structure of the hemoglobin, like RBC, from the discoid to that yes, uh, sickle cell shape, which that is causes a lot of problems during the within the circulatory system, and which leads to hypoxia condition and the anemia, like that. Cystic fibrosis mutation, which affect the lungs and all those things, right? So now the thing is, most of the that researchers and the clinical doctors, that yes, they are sharing their knowledge to develop the precise medicines for these disorders, right? Now, particularly the biochemists. And a very important and interesting area is biochemistry of the cardiovascular diseases and the molecular mechanisms and the risk factors. So, like that, that it is lipid metabolism imbalance, like lipoproteins and that LDL as well as HDL and the VLDL, and how their levels, that will be changed or affected in various conditions is so very very, very important, and which directly contributes to the that yes, cardiovascular system, which is considered as the leading cause of morbidity or the mortality, high mortality rate across the globe. And that if you see this, the very that yes, complex biochemical processes are hidden in this, that CVDs, like which leads to endothelial dysfunction and oxidative stress mediated by reactive oxygen species and atherosclerosis, like that. So to for a better that yes, treatment, to suggest a better treatment for the CVDs, one must have that yes, a strong basic and the fundamental knowledge about the that biochemical knowledge about the CVDs, about the lipoproteins and the fatty acids and all those things, and the biochemical mechanism. So the major areas, as we discussed, atherosclerosis, that is the LDL transport, that is that the bad cholesterol, LDL cholesterol, will be accumulated, that's which leads to the formation of the plaques and the hardening of the blood capillaries, right? And the endothelial dysfunction, right? Reduced nitric oxide levels also causes that it is at molecular that levels. So endothelial dysfunction, that it is frequently seen in that smokers, where that yes, the nitric oxide signaling will be altered, right? And the oxidative stress also, like the reactive oxygen species such as hydroxyl radical, superoxide radical, alkoxy radical, nitroxy and peroxy radicals, they causes oxidative stress. And oxidative stress uh, has been implicated in that yes, in most of the disorders such as cancers and the diabetes and all those things. And the imbalance of oxidative stress and reactive oxygen species or the free radicals and antioxidant imbalance leads to cardiovascular diseases, and even the inflammation, like pro-inflammatory cytokines also, the levels or that very much increased in CVDs, right? If you focus on these cytokines levels in CVDs, it helps us to know about this condition CVD progression also. And it is quite, that yes, lengthy explanation, particularly, that CVDs are very, very important. Lipid metabolism is, that plays a vital role in CVDs, which is totally altered like lipoproteins. You can focus on, that yes, LDL, HDL, and apolipoproteins such as ApoB and A1, and which are the key biomarkers in, that CVDs, particularly which comes under lipid metabolism. And that genetic factors also influence the CVDs. For example, these heart diseases nowadays, the scientists are claiming that these are hereditary and genetic. Hereditary means that the lipoprotein metabolism like is affecting hypercholesteremia, familial hypercholesteremia, and the polymorphism in certain genes, right, which leads to renin-angiotensin aldosterone system, which regulates the blood pressure. And that several that yes, genome sequencing studies that reveal the variants of the different types of variations in particular gene systems. And environment interactions also, like epigenetic modifications like histone protein modifications also do causes these CVDs. And that these are at a very molecular level. People are because of the advent of technology, the scientists exploring at molecular level and identifying, they came with publish different that yes, possible mechanisms from every corner of the that yes, metabolic aspects. And how do you prevent this CVD? Simple, that is lifestyle, maintaining that is good food, healthy habits, as well as by following the lifestyle modifications like exercise, as well as the diet, like must be enriched with the proteins and a high amount of proteins and the less amount of that fat and the moderate amount of carbohydrate, like that. And regular physical activity must be 150 minutes per that is week is required. And the cessation of smoking, abstaining from alcohol, that mitigates these CVDs, right? So that is the major problem nowadays. Smoking and alcohol, that yes, people are starting for once or twice in a week or occasionally, and they are habituated. Then finally, they directly associate with the CVDs. And the pharmacological interventions, there currently people are using statins, right? Atorvastatins, which directly targets the cholesterol metabolism, such as HMG-CoA reductase, like that is acetylcholinesterase inhibitors, beta blockers. Currently, the management of the CVDs are dealing with this kind of drugs, right? Now, in addition to that, that we must change our lifestyles also. Then only we can lead the quality life. If we solely depends on medicines alone, it is not the solution, right? What we are eating and how we are leading life also very, very important, right? So then emerging therapies, that yes, severin, like that yes, protein kinases, PCSK9 inhibition also. Sorry, also is the that yes, promising target. Gene therapy approaches, and as well as that RNA interference, that is iRNA technology also mostly focusing. It's still at infancy stage, that, but promising. I know that yes, results are obtaining in laboratory mice and in vitro cell cultures like stem cell therapies, like that. We hope that yes, a better medicine will be that yes, some good drugs with low cytotoxicity will be produced soon. And next, very important, which directly connects to CVDs and the lipid metabolism, is the biochemistry and the pathophysiology of the obesity. So this is, that is very important nowadays. If you see out of 10, around 6 to 7 male or female, they are obese, right? Generally, according to the WHO statistics, like that, right? Because of their food, junk food. and that yes, bad food habits and all those things, and sedentary life and lack of exercise. Now, what happens if you eat excess of food? What will happen? That yes, there is a hormonal imbalance will happen. There are two important hormones are there, leptin as well as ghrelin. That deals with our hunger. There will be imbalance which also affects the that is metabolic disruption, like insulin resistance. So if you understand these mechanisms, that we can handle the obesity easily. But what I'm saying that obesity is the root cause of all diseases. It is the root cause, that let's say diabetes or the hypertension, that yes, all or that if in most of the obesity people they are diagnosed with either diabetes or the hypertension or both, because of that yes, their food habits and excess of fat accumulation and all those things. So then what happen if you see the energy balance? Adipose tissues are the fat storage tissues. There are two types, white and the brown adipose tissues are there. But energy homeostasis is very, very, that is important. Like it was under the control of hypothalamus. We know that. But apart from that, that adipose tissues secretes some kind of, that proteins like adipokines, like leptin, which suppresses the appetite. In obese people, what will happen? The leptin levels will be, that yes, altered, as well as, that the ghrelin, another important hormone, ghrelin also levels. There will be an imbalance. And that to understand these obesity metabolism mechanisms, we must have a knowledge about these adipose. One must have a proper idea about these hormones as well as adipose tissues, like which the imbalance leads to that yes, weight gain and metabolic dysfunction. Not only it affects the lipid metabolism, it interferes in carbohydrates and other metabolism also. For example, dysregulation like insulin, that yes, resistance and lipogenesis will be excess, means the synthesis of lipid will be more, and the accumulation of the fat, which leads to, that yes, insulin resistance also one of the reason. And that yes, lipogenesis will be more and the lipid breakdown will be less and the fat will be accumulated, which cannot be burned or utilized. By exercise only, by calorie management only, we can handle the obesity effectively. And excess of free fatty acids also, that yes, it's very bad. This the breakdown of fat triglyceride will produce free fatty acids, right? Free fatty acids, they always combines with glycerol and stored in our body in the form of triacylglycerol or the triglyceride. So what happens if the free fatty acid levels beyond, that 150 milligram per 100 mil or the DL, it slowly increases. It should be around 100 or like that. If it is more, it interferes in insulin signaling also, which affects the carbohydrate and the lipid and the protein metabolism. And the key regulators are, that yes, fatty acid synthase, FASN, and that SREBP1, that yes, like these are the, that lipogenesis regulators, and which we can regulate these, that enzymes at their transcription level or the mRNA level, like that, which may provide a solution to the, that yes, obesity. And the pathophysiology of that yes, obesity mediated complications, insulin resistance. So no doubt that yes, the insulin resistance is the major one, that yes, and insulin signaling will be affected. So and that hormonal imbalances also, that happen, that leptin resistance will happen. Ghrelin, that yes, which causes the hunger, will be, that yes, imbalance. So thereby, that people will take excess of food, and that despite of feel hunger feeling and all those things. And the chronic inflammation also, that yes, it leads to this obesity causes chronic inflammation, one of the major factor in insulin resistance and cardiovascular disease. And therapeutic approaches to obesity management, because I just dedicated more slides in this, the domain like obesity, because nowadays, people are suffering with this obesity, and which is the root cause for other diseases and the disorders, right? And lifestyle interventions are balanced diet and the regular exercise and the behavioral therapy, right? And pharmacological aids like statins and that yes, glucagon like peptidase one, that receptor agonist, glucagon like peptides, right? And newer medications. So GLP-1, that agonist, they causes the insulin release, thereby promotes the metabolism. That is carbohydrate metabolism. That is that it reduces the glucose levels, and it controls the hyperglycemic condition. Surgical interventions like it is that if it is extreme like bariatric surgeries and like that gastric banding like that, that is they're not suggestible for their for everyone based on conditions and the patient health status. And the third one is emerging therapies like now that most of the research is that yes, gut microbiota. Gut is our second brain, right? So generally gut health is also very very important, like our brain health. Generally gut is what you eat also, it reflects it. I know that it influences your metabolism and the behavior also, it was proven scientifically. So but gut microbiota, that interventions and endocannabinoid, that system therapies also, that like probiotics, lot of probiotics also, that is developing. There's still a lot of research is going on to control the obesity. Second one is integrative approaches of obesity management, like comprehensive assessment and body mass index, and evaluation of medical, patient medical histories, and regular medical checkup, and monitoring the that yes, the body weight and metabolic profiling and everything. That mostly you must one must be very cautious what they are eating and how much weight they are gaining and all those things. And personalized treatment plans also, that very very important, such as medication and surgery, bariatric surgery if needed. That is the last option. And a multidisciplinary care system also very very important, like not only the doctors, physicians, sometimes dietitian role and food and nutrition is very very important, right? And sometimes you need the psychologist, career counseling also, and long-term monitoring support. So because these are chronic disorders, it is not possible to control within a stipulated period of time, like 3 months or 6 months. There is no time bound. It should be in a long-term monitoring and support care system is required, right, to manage this obesity effectively. And next one is, that biochemistry of endocrine disorders. It is also very important, and that lot of research is going on in these that is disorders. Uh, so if you see the endocrine system, that several endocrine systems are there, like hypothalamus and pituitary and the thyroid, and which produces the chemical messengers. So these are the biological middlemen, which taken the control of the entire body, like right from the metabolism and the cell signaling and growth and development, whatnot, our mood swings. From simply, I can say that these hormones, they can regulate from mood to the metabolism, right? So the behavior of what you call the person and different conditions and different environmental situations or the conditions, that all are being that influenced by hormones, and the metabolic regulation and the feedback mechanism all comes under endocrine system. Now we'll see, if you see these disorders, most of the disorders are that metabolic disorders and the endocrine disorders such as thyroid. This is hypothyroidism is commonly seen in that yes, in this generation people, like particularly in the pregnant women as well as even in youngsters also, like TSH levels and the T3 levels are frequently altering. You can observe in hypothyroidism how the TSH levels will be that change. By monitoring the TSH levels, you can anticipate what kind of that thyroidism it is, hypo and the hyperthyroidism, like the diabetes mellitus. And also it is also endocrine disorder, right? It is Of course, chronic disorder, but it comes under that endocrine disorder. It deals with insulin, that is the deficiency, and the adrenal disorders like Cushing's syndrome. That is hypersecretion of cortisol and metabolic disruptions, Addison's disease. A lot of disease. These are few examples only. Most of the that endocrine disorders are some of the endocrine are fatal also, and biochemical mechanisms, and that is hormonal imbalance like insulin resistance pathway, like blood transporters, how the blood transporters involves in glucose transport, and how the insulin resistance affects the the glucose transport mechanism. We already discussed it, right? And the gluts are the glucose transporters that facilitate the glucose transport into cells, right? And the thyroid hormone regulation, like that, yes, we need to focus at the mitochondrial level, because thyroid hormone, it will exhibit the permissive effect on other hormones like adrenaline, like that. So which has influence on other that is endocrine system also. And hypothalamic and pituitary and adrenal, like axis, this axis is that the coordination is very very important, right? And the feedback loop, that is regulation of these glands are very very important, like for metabolism, particularly like gluconeogenesis, lipid metabolism, and the protein breakdown metabolism or the catabolism, like that, energy balance, all those things. And the treatment approaches are that hormone replacement therapy. Now most of the research is focusing on replacement therapy instead of regular medications, like that. And insulin therapy and the oral medication also, that yes, they are focusing like stem cell therapy for beta cell regeneration. That is still a lot of research is going on. And like that, to improve the sensitivity towards a specific enzymes through insulin, like that adenosine monophosphate activated protein kinase. This is the recent advance of the that breakthroughs. And the surgical interventions also, that yes, in hyperthyroidism, or as well as the goiter and all those things. So the removal of the enlarged gland is the only solution, like that. So sometimes that surgical intervention also required. And the biochemical, that impact of biochemical, that basis of to understand the that yes, endocrine care, it is very very important. Like targeted hormone assays, biological markers, and for example, certain hormones levels will be elevated in specific endocrine disorders. By monitoring these levels, we can what you call assess the disease condition, like that. And the biochemistry of the neurodegenerative disorders, a lot of research is going on in this domain, like molecular mechanism and the pathology. Neurodegenerative disorders are, that yes, this is very interesting area where most of the research is going on, like Alzheimer's, Parkinson's, and the Huntington's disease, like that. So mostly these are associated with the protein misfolding and the mitochondrial dysfunction, and the several inflammatory factors will affect the brain function, right? Sometimes it will be irreversible also. So once damage happens, the repair or the recovery is not possible. It is very that important to identify at the beginning stage, thereby we can stop the further progression. And key neurodegenerative diseases are Alzheimer's disease, as well as Parkinson's disease and Huntington. And a lot of that research is going on at molecular level to provide the solution to these diseases, right? And therapeutic advances, like general molecular mechanisms in this area, is protein misfolding and the aggregation, right? Like several molecular chaperones have been developing to they treat this protein misfolding. The recombinant proteins are developing. And the mitochondrial dysfunction and the oxidative stress also, that yes, the if, say, mitochondrial targeted drugs or the therapy. So in these disorders, the mitochondria is a very important, that cell organelle. In these neurodegenerative disorders, in some cases, that the targeting the mitochondria is also very very important. Sometimes it may give better results also. Neuroinflammation also, that yes, we can control the immune modulators, thereby we can mitigate the inflammatory and neurodegenerative disorders. And advanced gene therapy. Now you know that we will discuss about this slide in the upcoming slide, like this technology, CRISPR technology, like gene editing technology. This is the recent breakthrough, not very recent, 10 years, 10 to 12 years back it was developed, but now it is giving promising results, like gene editing, right, without damaging the, that affecting the nativity of the genes. uh, Genetic mutations also, that in biochemical perspective. So see, all these disorders, because of, that point mutations or single nucleotide polymorphism, a single nitrogen base change will affect the, that is the gene's function. And the protein or the product produced from a specific mutated gene may, that is affect the entire cellular scenario, like that cell cycle uh, dysregulation, as well as, that is metastasis, and so many things are there. And frame shift mutation, nonsense mutation, and so one must know, identify what kind of mutation it was and how it affects the, that cellular machinery or the, that system, like that. And several types of cancers, that most of the cancers arises due to these single nucleotide polymorphisms, right, in tumor suppressor genes, all those things. And the clinical applications of this, that yes, so a lot of, that yes, gene therapy advancements have been developing to understand these SNPs as well as mutations. And diagnosis and treatment approaches in newborn, that gene therapy, that it is the promising tool, which can, by using this, that which we can prevent the, that is the prevalence of the diseases in the upcoming or the next generation, like that, right? Like severe combined immune deficiency disorder, such as the immune deficiency disorder was successfully treated in a, that is 13-year-old Sri Lankan girl, long back ago. Now that, that was the first case of gene therapy. Now that girl became a doctor, and she is leading the life successfully, both professionally as well as, that personal social life also. So there is a lot of, that yes, misunderstanding, or the, I can say, misconceptions about the gene therapy. Right, a lot of ethical issues also there. Now that scientists are resolving one by one, like that. So biochemistry of the immune system, that yes, just to before you go to the cancer biology, you must understand our one must understand our own immune system, how it is composed of, what are the cells produced by the system, like that. We know that these are very fundamentals. Just I need to focus on some more slides. Let me uh, uh, explain quickly, precisely. The first line of defense is that is, that is humoral immunity, that is the physical barriers like skin and the mucosal membranes, and the, different types of pattern recognition, molecular patterns also there, that leads to immune cell activation, cytokines and interleukin production, and the phagocytosis by neutrophils and the macrophages. These are the basic, that yes, immune defense mechanism, or the first line mechanisms, like TNF, tumor necrosis factor alpha, and interleukin 6. They are basic, that yes, the proteins produced from the immune competent cells that mediates the inflammation, right? And adaptive immunity, like different types of cells also there, T helper cells, B cells, and immunity, because to understand the HIV, as well as, that yes, HIV virus mechanism, and we must have the basics of, that, not basic, we must have the complete comprehensive knowledge of these T cells and the B cells and the receptors like CD4, how the CD4 count will be changed in that is in HIV patients and all those things, right? And the beta cells also that yes, these are the plasma cell. Matured beta cells produce different types of antibodies such as IgM, IgG, IgA, like that, which are very very important for that yes, immunity, like immune memory, like what how the vaccines will work. That is about the immune memory, right? And that immune disorder, for example, NF-kB, nuclear factor Kb pathway. This if this pathway is altered, that yes, it leads to the change in total immune system, like. And JAK and STAT pathway is just another kinase and signal transducer and activator pathway activated by cytokine. So, see, several immune cell produce a mediator protein molecules such as cytokines and interleukins, which are very, very important for that yes, the immune cells metabolism and the immune cell division and activation and all those things. For example, let us say MAP kinase pathway, mitogen activated protein kinase. It plays a very important role in the immune cell division and that yes, and their interaction and association. Several autoimmune disorders also, that immune deficiency disorders and autoimmune disorders also. Uh, that yes, nowadays most of the research is focusing in this area, immune disorders. Uh, Targeted therapies also, that is very important. Immune cell targeted therapy, particularly immune checkpoints in cancer biology. So another fascinating area, that is cancer biology, and the mechanism and the therapy is also very very important. And let it be you are a researcher, or that yes, are a biochemist or the doctor, the knowledge of that yes, the biochemistry is very important to understand the cancer biology, how it behaves in various circumstances, and how it spreads and how it circulates in our body, right? Suddenly a patient or a person or he or she declared with that a cancer patient, like that, how it is possible? Yes, a single mutation can change because of genetic factors also. Nowadays that yes, it is possible for the cancer prevalence. It's an ocean, right? Cancer, once we start land in cancer biology, it will take that yes, years and years to understand their mechanism. It is a complex disease characterized by the uncontrolled cell proliferation and spread. That when there is no control, normal cells under the tight control or the scrutiny of cellular machinery, how many times it has to be duplicated and where it has to be located. Everything is under scrutiny, or that monitored, properly monitored. But cancer cells, they deviates from all this, that yes, cellular monitoring, and which that causes the metabolic imbalance. What are the reasons? Like genetic mutations, epigenetic changes such as DNA methylations and histone modification, environmental factors that drives its progression. Understanding cancer mechanism is very very important, right? To lead to develop targeted therapies and immune checkpoint therapies, like that. And what are the hallmarks and basic qualities? Several problems, characteristic features are there. First one is the sustained proliferation, that they develop their own mechanism, and they never under the control of other, that is any other cellular machinery. They develop their own machinery for their duplication and growth and development and evasion of growth suppressor, like that they escape from the cellular monitoring. As I told you, cellular machinery is a very very that is tight security system, such as tumor suppressor system, like P53. P53 means that is the gene that produces the P53, which is the guardian of the human genome. That is the savior of the human genome. So the cancer cells, what they will do, they bypass the scrutiny or the monitoring of this, that is the cancer the cancer cells, they bypass all these scrutinies, particularly from the P53 system, which leads to that uncontrolled that yes, cell proliferation of the growth and resistance to cell death. This is very important. Normal cells, that they obeys apoptosis. Like there are two kinds of protein, pro-apoptotic and anti-apoptotic protein. So these cancer cells, they what they will do, that they suppresses the pro-apoptotic proteins and they elevates, that yes, anti-apoptotic proteins, that is BCL2. One of such cancer cells expresses high levels of BCL2, like that yes, one this is a family of genes that regulate the cell death. Right. So these cancer cells, how they survive? They survive by that increasing like anti-apoptotic system, and they deliberately suppresses the pro-apoptotic system, such as BAX and BAD system, like that. And the third one is that is angiogenesis induction. So then what happens is that the cancer cells, like they produce several that use the protein molecules, and which stimulates the new blood vessel formation, and with the new blood vessels they establish the network with the adjacent cells, and to draw the nutrition and other that yes things, thereby they survive. And one next one is that yes metastasis, that is the spreading of cancer cells also very important, right? Like they by secreting certain enzymes they spreads, like hyaluronidase and matrix metalloproteases. With the help of these enzymes, they successfully breaks the extracellular matrix, and they escapes the tissues and reaches enters into the lymphatic system or the blood, and they reaches various destinations where they duplicate and form tumors, like that. And the molecular pathways and metabolism, so they promote cell survival, like that AKT and the mTOR. That mostly what they will do, they hyperactivate certain pathways. These pathways are responsible for the cell survival and growth. In normal cells, these pathways are under tight regulation. But in cancer cell, there is a deviation. Intentionally, what they will do, they hyper activate. That yes, they operate in a in a that is high fold manner, so thereby they survive. And continuous operation of mitogen activated protein kinase and extracellular regulated kinase pathways, which causes a continuous production of cyclins and cyclin dependent kinases, which ameliorates the cell cycle continuously, that eventually ends with the tumor formation. And the next one is WNT, that certain receptor pathways are there. They deals with what you call the cell death. The cancer cells, that escapes from all these, that yes, cell death pathways. So then, that yes, thereby they survive in under special or that yes, odd circumstances also. And very important concept is Warburg effect. So one must understand how the cancer cells survive, right? So they simply survive by deviating the, that yes, metabolism. So what they will do, that yes, generally what will happen in a normal cell, the glucose is converted to, that yes, pyruvate, right, with a concomitant generation of energy, which is called glycolysis. From glycolysis, that yes, now the from cytosol, the scenario will be shifted to the mitochondria, where TCS cycle pyruvate is converted to the acetyl CoA, and the TCS cycle followed by electron transport chain oxidative phosphorylation will happen. So, but in cancer cells, what will happen? That yes, the cancer cells use aerobic glycolysis for that yes, rapid growth, and they need energy for their survival. So from this, that pyruvate, that they produce lactate. If you observe this way, mostly the lactate levels are more, that is cancer cells. So that's why what I'm saying, that to understand this was first identified by that yes, Warburg, right? So uh, next one is Warburg effect. He is the scientist first, that he has identified how the glycolysis is deviated, how the ATP levels are, that he is misutilized by the cancer cells. It was first explained by the Warburg. So because that in what is the difference between that is between normal cell and cancer cell? the metabolic imbalance. So that's why if you see the cancer patient, suffering people, they become innervated or weakened, right? Yeah, so the targeted cancer therapies, our first one is, monoclonal antibodies like trastuzumab. MAB means monoclonal antibodies produced by, that is some specific cell lines, like which are having immune cells, right? Like immune competent cells. This is, that yes, they reaches the target perfectly. Particularly now, it is the promising drug for the, that yes, breast cancer patients, like that. Like human epidermal growth factor receptor 2 mutated, that breast cancer, like rituximab treats the, that yes, certain types of lymphoma, like the tyrosine kinase inhibitors, which blocks like imitin, which targets the receptor tyrosine kinase pathway, like MAP kinase pathways. Even it interferes at, like cancer cell progression and invasion. And then you can say that imitinib is a magical drug and successfully treated with the chronic myeloid leukemia. And erlotinib, these are, the new advents like targeted therapies. So this we are precisely, that specifically targeting the problematic area. Thereby, we are, that yes, aiming to prevent the spreading of cancer cells. And the immune therapy also, that immune checkpoints. Now, most of the, that researchers are focusing the immune, that therapy, that, that several checkpoints are there, cell cycle checkpoints and immune checkpoints. By using certain drugs, that yes, they are inhibiting the cancer cell, that progression. And the challenges are, that yes, there's a lot of challenges are there in every technology having, that yes, advance having advantages as well as a lot of challenges and disadvantages. And we are trying to, the scientists are trying to, that yes, address to these challenges one by one. First one is the drug resistance. This is the major area, that yes, in tumors. A lot of tumors are very intelligent. Like, you can say that HIV virus is also very, very intelligent. Like we think humans are the most intelligent person. Like certain organisms are very, very important, but the tumors within our, that yes, within our in our body, they can act very intelligently. Then, that they deceives the entire system, right, by a single protein or the signaling system. Right. So, like they developed, that yes, certain proteins to develop the drug resistance. So now the major challenge is to prevent this, that yes, we should come up with a drug which can, that effectively treat drugs which can effectively treat the cancer with less or, that minimal cytotoxicity. And the personalized medicine, it is due to the genomic profiling only it is possible, and the metabolic targeting. For that, that we should have the complete genome profile of the patient, and thereby we can make that, that yes, treatment plan combinatorial means by combining various types of therapies we can make combinatorial therapies. And challenges and the future directions are, the drug resistance mechanism. As I told you, that immunosuppressive tumor microenvironment is also another promising area. A lot of scientists and the immunologists are focusing to handle this, that yes, cancer and the tumor invasion and the tumor heterogeneity. And the future directions are mostly focusing on, that personalized medicine through the patient's genome profile and targeting the cancer metabolism. As I told you, that yes, previously I discussed about the Warburg effect. Like that, we can target the glycolysis and the citric acid cycle mechanisms and certain, that yes, mitochondria. If you target the mitochondria in cancer cells, what will happen? Yes, the energy will be production will be stopped. Then the survival of the cancer cell will be, that yes, in question or the doubtful. So that's why metabolism targets also we need to focus, and a combination of therapies. And the cancer vaccines like DNA vaccines also, that developing. Second one is the liquid biopsy, like with a single blood drop. That biopsy generally requires the specimen or the tissue, but the liquid biopsy, what you call the blood drop or the serum can be, that yes, enough. In future, maybe saliva also, or the sweat also, that yes, can be used, particularly like a serum drop is enough to, that yes, identify the. See, these are the future emerging strategies scientists are focusing, and the nanotechnology based drug delivery, like, which can reaches at the interior region at the cellular and molecular level of cancer cells. And the biochemistry role in drug development and personalized medicine is also very, very, that a tailor-made drugs also very important according to the patient. For that, we should have, that yes, the entire genomic profile and the mutation details of the patient, and the target identification, structure-based drug design. For that, that yes, we require some several drug designing tools, and for that we need a solid and valid data that can be produced from the X-ray crystallography techniques. And further, that to develop any drug, we need to understand the three-dimensional structure of the protein completely. Then only you can make, that understand the side chains of the protein, targeted protein. Thereby, we can make an effective drug which has high affinity towards that particular, that is protein or the target. And the high throughput screening also, that yes, it is it starts with, that thousands of compounds, that eventually ends with, that yes, lead compound, and finally, that a single or couple of drugs will be generated. And personalized medicine, that yes, for example, like, you can decide the dosage of the, the drug also based on the genetic profiling and the biochemical markers also. Certain markers or, oncogenic markers expressed in certain persons in more or less, like that. By observing these things also, we can make the, the drug. But these are, that yes, the possibilities scientists are focusing to develop the drugs in futures. uh, and the computational biology. So then let me explain quickly. So the involvement of computers is very, very important nowadays. People thought that, that for the researchers, what is the role of computer? Not only for making graphs or, that storing the data, not like that. So that to understand the life, that we must, that preserve the data properly, like nucleic acid sequence databases, protein sequence databases, protein structural databases, like that. So with the advent of, that yes, in post genomic era after 2000, lot of data has been flooded from the whole genome sequencing center to the world. Right now, we must, that preserve the data and store the data in a specific computer readable format and make it available to the scientific community across the globe. That is the big challenge. So now what happens because of the advent of technologies, the computational biology or the bioinformatics, that yes, that provided the solution. These are very, very important tools. And not only, that storing the data, a lot of, that bioinformaticians develop tools to predict the protein structures and to align the sequences, to infer the phylogenetic relationship, like that, between these, that yes, newly identified microorganisms. So we must understand the phylogeny also. Further, these databases and the, that yes, these tools are very, very important. I know that yes, for example, in olden days to study the nucleic acid sequences, it will take, that they used to copy the sequence or paper or on board, and they used to compare manually. Now within a single click, that you can compare the data with fast blast and fasta, like that basic local alignment search tool, and fast sequence similarity search tool. Lot of tools are there which helps us to uh, go for pairwise alignment or the multiple sequence alignment. So this data can be preserved in nucleic acid at the protein databases. These are very, very important, right? And such as GenBank and EMBL, because whatever the advance like cancer biology, like personalized medicine, immune target therapy, immune checkpoint therapy, so all these things, they require the certain protein and the gene sequences formats. Those were maintained by, that yes, gene bank, that by NCBA, National Center for Biotechnology Information. and European Molecular Biology Laboratory, EMBL, and EBA, European Bioinformatics Institute. So these are pioneers in that yes in biocomputational biology. Now you know that we can access the whole genome sequence from the that ensemble or GenBank databases. For example, I want chromosome 21 entire sequence. Yes, I can that access it. I can that download it. So more than that yes, around 8,000 organism sequence, new genome sequences have been deposited in these databases. And DNA Data Bank of Japan, it is a Asian-based data bank. They are also having a, a very good range of tools which helps in data analysis, right? Now the data science, that ruling the world, right? So not only in computer science, even in biological and the medical sciences also. These protein sequence databases, these are hundreds of databases are there. These are prominent databases like PDB and Uniport and PIR. What is the significance of this database? Simple, you can access any protein structure, three-dimensional structure from these databases. And the sequence, typical sequence formats, and you can design the simulate the proteins, and you can go for the 3D modeling of the proteins, so like that. So then only you can go for drug designing, and with the help of that you can for example, in olden days drug designing and the synthesis is quite very laborious process. It will take years and years. Now the time has been reduced by at least that yes, by 50%, more than 50%, right? So previously, let's say it is a 10 years effort. Now it is 2 to 3 years effort. That yes, to synthesize a proper molecule like that. Of course, a lot of formalities has to be done, like after synthesis and clinical trials and pharmacovigilance. I'm telling the efforts, that yes, these technologies, that yes, databases and the tools, they minimize it, the that yes, human effort in terms of time particularly. And next one is the genomic and the proteomic databases. As I told you, NCBA, Uniport, PDB. These are very, very useful to having all type of data, like in normal as well as diseased condition. For example, you want to see the P53 tumor suppressor protein system, what you call gene system. You can access with a single click. Go to the database and you can check and how it is affecting in cancer cells are like that. A single mutation causes the changes, all those. And also metabolic databases also there, like Kyoto Encyclopedia of Genes and Genomes and online Mendelian Inheritance in Men. They, what is the significance of this? So we are discussing about the for medical, that yes, researchers, the scientists, of course, that yes, it's a mix of pure researchers and the doctors and all those things. So it's a consortium. So if you see the OMIM, personally, I can say that I use this database. It is very good database, and which is having human genes and the genetic disorders. Exactly where is the problem and where the mutation is observed. All these things, detailed with publication links, research document. They will provide the links also you can access. And the Reactome also, that yes, it's a new database. It covers the, that yes, human biological, metabolic, and signal transduction pathways. And systems biology, that yes, one can have a comprehensive cellular view with this data understanding and the data integration to develop a holistic approach and advanced medicine, which plays an pivotal role in advanced medicine, biotechnology, and molecular biology. And groundbreaking discoveries, like that yes, people are waiting for it, like for particularly for the cancer and the HIV, like that, which are very challenging, giving lot of challenges day by day. So these groundbreaking discoveries can be possible with this, that yes, the combinatorial research. And now that gene editing tool, that yes, it is one of the important breakthrough, that is the CRISPR Cas9. That yes, it is a guide RNA technology like that. That which edits the base. Then what happen in embryos like that? Then what happen is it can cure the ailments at the beginning level like that. Still lot of research is going on, right? uh, it was started 10 years back, and innovative applications of systems biology, like databases, disease, to understand the disease mechanisms. They helps us, these systems as well as the tools and databases, and it helps us to develop the new drugs, right? And synthetic biology, particularly, you know that yes, microbial genetic engineering to produce specific therapeutic agents like cytokines and the interleukins like that, by changing their uh, certain, you know that yes, gene systems, that is called metabolic engineering, metabolomics. And biochemistry and rDNA technology, simply you can say that biotechnology. Currently what people are using this insulin and, you know that yes, tissue plasminogen activator for to clear the brain clots and all those things. They comes under, you know that yes, these are the products we are currently enjoying the fruits of biotechnology, right? Like several drugs have been developing, like human growth hormone and the erythropoietin in kidney patients, like, you know, anemia. Anemia is the major problem in CKD as well as, you know, that cancer patients, where the, you know that is particularly kidney and the liver will be affected. For example, CKD, erythropoietin can be produced from, you know that is kidney only. In CKD, you know that the erythropoietin producing ability will be declined. So what we have to do, we have to take the erythropoietin through injections. So like that, to meet the demand, you know that we need to produce in high quantities by using this recombinant DNA technology, that is the genetic engineering and the manipulation. And monoclonal, I already told you, MAB, you know that yes, these are magic drugs like that. You can say that they target the breast cancer and lymphoma. They are, you know that yes, I cannot say that 100% treatment, but you know you can cure at least 80 to 90% like that. At least we can stop the progression of the cancer. So then we can focus on the treatment mechanisms like process and gene therapy, vaccines also, you know that yes, a lot of research is going on in this area. And enzymatic clinical applications such as glucocerebrosidase, like, you know, which can treat the Gaucher's disease, like, you know, lipid accumulation at the brain. And diagnostic engines like glucose oxidase. For example, in every house nowadays, the glucose devices, blood glucose monitoring devices, they are like a household item it became. If you see the strip, you know that the glucose strip and machine, if you see the mechanism, the glucose oxidase is immobilized in that, what you call the strip. Then like that, you know, a lot of, you know, because of this rDNA technology, a lot of advance have been, which makes the life, you know that is smooth. I can say that you need not go to laboratory to check your blood glucose levels. In olden days used to go and they need to uh, draw the blood by using syringes like that. So thrombolytic engines like tissue plasminogen activator dissolve the blood clot. These all are, you know, recombinant DNA technology results or the achievements. By rDNA technology revolutionizing the modern medicine such as biochemical foundations, right? And therapeutic protein production like insulin, growth hormone, and the TPA, tissue plasminogen activator, and several drugs and monoclonal antibodies and enzymes, right? All these comes under, these are the results of fruits of, you can say that, we can say that the fruits or the results of the recombinant DNA technology. It can offer a precise treatment, life, and it can produce life-saving drugs and diagnostic tools such as blood glucose monitoring and the hemoglobin monitoring. All this, you know, that is uh, they promises limitless future applications in healthcare. And the future of biochemistry, emerging technologies and perspectives. So this is very important, like nanotechnology to deliver the drugs effectively, right? In most of the things, you know, that because of the cellular barriers, the drugs are not reaching the targets effectively. But for the effective transport of drug delivery mechanisms, you know, that yes, the biochemist, you know, that lot of research is focusing. And revolutionary technology like gene editing technology also. It is a lot of research had to be done in these areas, right? And gene editing technology, single cell analysis technologies also now most of the research is focusing. And nanotechnology in medicine also, that is another promising area. And multi-omics approaches like genomics, proteomics, metabolomics, right, with the help of databases and tools, which that is analyzes the data effectively. Data means might be mutated protein or the DNA sequence. Once we understand the that is the data completely, then we will get an clue at least about the ailment or the disease or the disorder. What are the features? So we are about to end the presentation. It's a bit lengthy, I know. Future perspectives in biochemistry. Biochemistry stands at the forefront. That yes, these are at the front of the scientific innovation, because of course it's not alone. It requires the support from other that yes, like organic chemistry, microbiologists, and that physicians, surgeons. It's not that one man show or the discipline. It requires the collaboration of others, other that yes, active researchers and people also. And what are these future perspectives? Interdisciplinary integration, like nowadays computers involved in medicine, as well as artificial intelligence, also material science, to develop nanotechnology, nanomaterial, like that lightweight, small size that yes, particles for drug delivery, and that, and surgical inventions like that. And global health, to address the global health challenges are like we faced, particularly this COVID, the first and second, that yes, pandemic things, and antibiotic resistance. This is very important. People are misusing the drugs, right? Particularly antibiotics. They are directly going to the pharmacy stores and medical stores, and they are asking the pharmacist. And there is a myth: if I take the double dose of antibiotic, the ailment or the disease will be controlled very quickly. But it is wrong. In excess, the medicine will be, that yes, can act as sometimes poison or the toxic also, right? In excess doses, it causes cytotoxicity. So because of this antibiotic resistance, that the new microbes have been evolving with more antibiotic resistance. That is another worrying factor. And the future trends are, that there's quantum computing as well as artificial intelligence, which could enhance the biochemical research capabilities. Biochemistry, that yes, in of course in medicine also, right? And continue directly and indirectly to the field of medicine. And the collaboration and that innovative approach is required. And targeted therapies in future, personalized medicine, and emerging technologies like CRISPR technology, gene editing technology, and all these we can address the the global health challenges like pandemic preparedness, and antibiotic resistance, and rare disease management, like that. So thank you for patient listening, and I appreciate all the that participants. And thank you very much, and gratitude to my School of Medicine, Texila American University, Zambia. And thank you to the audience for the patience, listening for your patience. And future horizon, the call to the action is, explore biochemistry for endless possibilities, right? Hope in future biochemists play a pivotal role in medicine, and it may suggest better, that solutions and the treatment for most of the diseases, like disorders like cancers, and other molecular disorders like diabetes and hypertension and cardiovascular diseases. Thank you very much. Now, if any questions or queries are there, you can ask me.
Thank you, doctor. And attendees, you can post your question in a Q&A box, or you can raise your hand. I allow you to speak, ask your questions.
So they can, that yes, type the questions.
Yes,
You
doctor.
can reach me at adurganaveen@gmail.com or naveen.kumar at tau.edu.zm. Naveen.kumar
Oh,
at tau.edu.zm. Okay, thank you, Mr. Naveen Raj.
yeah, thank you, attendees, and thank you once again, doctor. And it is very useful sessions. Thank you, doctor.